And Professor David Nutt joins me now. Congratulations.
Thank you very much.
Do you stand by what you said in 2009 that got you sacked?
Well, yeah, I do. And I think actually since then I've realised there's been greater problems as a result of some of the failure to be logical about drugs. And particularly it's been clear in the last few years how medical research is impeded by the drug laws. So the laws we've put in place to stop people using drugs are actually stopping scientists using drugs and developing new treatments.
But would you say it in the same way as you said in 2009, or would you be more judicious?
No, I think not. I think I'd be even more forceful now because clearly, you know, we haven't moved on. In the last 4 years, if anything, we've moved backwards.
But do you accept that politicians have to, there's a calibration between what you as a scientist say, between, they've got to take into account the victims of drug abuse and also the politics, essentially?
Well, I would say where you have good scientific evidence that a policy is not working or a new policy would work, you should bring it in. And if we really want to reduce the harms of drug use to people, we should do something about tobacco and alcohol.
But do you still think that tobacco and alcohol is more dangerous than LSD?
Unquestionably,
And would
yes.
you legalise LSD then?
No, I'm not in favour of legalising drugs. I'm in favour of having some kind of regulated access, decriminalisation for users, but in much more of an equal playing field between the drugs which we currently are suffering from, tobacco and alcohol, and recreational drugs.
You wouldn't decriminalise cannabis then?
I'd certainly decriminalise cannabis, absolutely.
And what about ecstasy then?
I think any drug that's less harmful than alcohol, which is most drugs, should be decriminalised.
Well, but on that basis, you would decriminalise LSD?
I would, yes, I decriminalise, absolutely. I don't think criminalising people who use drugs is useful at all. We know that from other countries where there have been real benefits in terms of interventions by decriminalisation.
Susan mentioned Khat, though, right at the beginning of that film. That is a controversial one, though, isn't it?
Well, not at all. I mean, the banning of Khat is completely unnecessary.
But we know it does hellish damage, doesn't it?
Khat does almost no damage. We only banned it because the Americans have been banging on to us for about the last 10 years to justify their banning it. So
let's just look more broadly then at what the government has done as far as you're concerned. Their record, as it were, on their response to what you would say is evidence-based science. Alcohol pricing. With alcohol, they treat alcohol. What's gone wrong?
Well, they just basically lost courage at the last minute. They started off making the right statement, minimum pricing, it will work, it will reduce harms to particularly heavy users, and then, probably due to pressure from the drinks industry, they backed off.
And is that, do you think, will have long-term damage?
Of course it will. Of course it will. Alcohol is now the leading cause of death in men in this country between the ages of 16 and 54, and minimum pricing would have reduced deaths by about 10%.
OK, let's talk about cigarettes then, because originally there was a plan to clear all branding, clear all advertising from packets, and that's been changed.
I'm sure that would have worked. With the Australian experience suggests that is working, because you take away the glamour of the cigarette.
So here we have, you know, the two things that you think are the big killers, alcohol and cigarettes, and you think the government is getting both of these entirely wrong. And 4 years ago, you're one of the senior advisors on the misuse of drugs. So where has the disconnect been in the kind of things that you as a scientist are saying and government policy?
Well, government is currently trying to get re-elected. So I think what they're looking at are simplistic ways of appealing to the population, to the voters. I think the voters know they're wrong. In fact, for instance...
But if the voters knew they were wrong, surely the voters, they would do the right thing themselves, whereby they would take less alcohol and they would also smoke fewer cigarettes.
Well, to some extent they're doing that. But let's be clear about this. Every taxpayer pays £1,000 in tax each year simply to allow us to service the level of current drinking through the health service and through policing, etc. So there's an enormous tax burden on people because we don't have minimum pricing of alcohol.
But on the other hand, people would say that actually people with free will make up their own minds, that actually what you're saying has been quite patronising to people who should be able to decide this for themselves.
Not at all, because actually the whole point about drinking alcohol is to take away your self-control. That is why most people use it.
Well, that's not the only reason for drinking alcohol, is to take away self-control.
But it's one of the major consequences of drinking alcohol.
But if people want to do that, then, you know, should they be allowed to do that? Or should there be then some kind of penalty on them when it comes to the NHS? Would you be in favour of that?
Not in favour of penalties, but I just think we need a rational approach. We should be pricing alcohol so that people drink less of it.
Are the scientists and the government not getting the message across then? You're out of government now. Are the scientists and government not actually, are they supine?
I think government scientists are in a difficult position at present because mostly they don't get listened to.
So are they being supine rather than actually risking their jobs?
I don't see anyone being as forceful as I was, no.
Thank you very much indeed.